20 years ago, ATW Health Solutions was born of a vision of equity, innovation, and impact. Inspired by the legacy of Anthony T. Washington, a man who embodied resilience and leadership, ATW was created to transform healthcare and to ensure that every person, caregiver, and patient had a voice in improving safety and quality care for all.
During COVID, I remember driving into the office, and at this time we were shelter in place. And I'd go into this empty office in this empty building, and I'd go into my office and I'd pull out all my whiteboards and I'd take the dry erase as if I had an audience of 150 people, and I'd draw the vision out daily, and I'd come back the next day and I'd do it all over again until I got it where I wanted it to be and what I thought was executable. The last 10 years of my career as an entrepreneur under the auspice of ATW Health Solutions. And I can confidently say that I have been an architect for systems change, that I have helped systems become more high performing through the work that I do, whether it's through research, whether it's education and training, whether it's the technical support that we provide. Really being an architect for high-performing systems is what we do. And so when I think back 10 years, where we started, and I look at, some of the very first projects up to the projects today, I see nothing but growth, but I also see nothing but opportunity.
Let me tell you why I'm excited about this organization. First, I'm sure you know it was born out of the pain and ashes of the founders, Dr. Natasha Washington's father's death resulting from a medical error. But what is profound about that is that the absence of the voice of her dad, a patient, propelled her to construct an organization that now represents the inclusion of the voice of many patients. Most people might have walked away in the pain of that experience, but she was strengthened and clear-visioned about constructing this organization, constructing an organization that allowed the inclusion and the insertion of every patient's voice.
Engaging diverse voices from communities, neighborhoods and cities, territories that are rural and urban areas have been the cornerstone of ATW's transformative impact. By understanding the unique needs of people and their experiences in healthcare, we have redefined what it means to create meaningful change and improved outcomes.
I've been supporting ATW for the last 10 years coming up. The CEO and founder, Dr. Natasha Washington, happens to be my oldest sister. So when ATW was birthed, I was there from the beginning. ATW is legacy for me. This is my family's legacy. The birth of the organization was driven by the passing of my father. And so the importance of what we do here every day is extremely important to me, important to our family, because it means so much. The effect that my grandfather has had on this company is that his legacy is so great, was so great. Anybody who had the chance to meet him, experience his greatness. Our family is nothing short of great. Every member of my family has done something substantial in this world. And I'm pretty sure it has a lot to do with what my grandfather instilled in him.
From its first groundbreaking project to becoming a national leader in healthcare transformation, ATW has been guided by its 7 P's principles: people, partnerships, purpose, passion, pioneering, performance, and principled action. These values drive our collaborations with government agencies, private organizations, and communities.
ATW came in and helped us to fully understand the communities that we were interested in learning more about, how to best approach them, what types of questions are appropriate and what types of questions are not appropriate, and how to go about this so that we not only do the best work we can do with our research, but that the community also gets something from the work that we're doing.
So when I say bless you with love and happiness, I'm not just saying it just to say it. I'm imparting into you, and we got to impart into each other. When I hear Dr. Natasha Washington, I know that we're talking about stroke, health. I know we're talking about a community leader that when I haven't seen her in a year, 2 years, when I see her again, it's like I saw her yesterday. There are people in our community, their name is synonymous with certain things.
I'm a patient first and a caregiver second. And I just want to bring my voice. And it's like, do you see me? And I want you to hear me, what I have to say. I see ATW expanding to Congress. Let's move up to Congress.
The experience that I have seen with ATW and PPIC has been that there are more people engaged and feeling like they can share their information. So it's been a growth. But what's also very refreshing is it's not a particular group of people, it's all people. So we created, ATW and PPIC have created an equitable place for people to express their concerns, their issues, to learn from each other. And as before, many voices have not been heard. And so ATW and PPIC are bringing forth those voices.
What began as the story of one man and the failure of one health system has transformed into an innovative system for change and healthcare improvement. Our journey has been shaped by incredible people, visionary leaders, passionate employees, and dedicated partners. Together, we've built a culture of innovation and collaboration that prioritizes health, equity, and safety.
ATW Health Solutions addresses health disparities. It is broader than just race or ethnicity. It could be geography. So we talk about urban versus rural healthcare. So if you think about that differentiation, for example, rural healthcare issues, what will be their issues? It may be drug abuse, it may be dental care, it may be just accessing care, right? So because of the geography and how widespread these people are, we cannot serve them the way that they deserve to be, we cannot provide them the healthcare that they need, right? So we also think about LGBTQ, right? And then, anybody who is considered other, right? I feel like those are the kinds of disparities that we need to be looking out for.
Patient Partner Innovation Community and the network members that are in there, the main goal is to really, a couple things. So empower them, right? So offer a space for them to come to know that they're fully supported, educated, and empowered into action, into healthcare transformation and delivery. So ATW Health Solutions really, calms on quality and safety and quality improvement. When you think about health equity and people think health equity is just to check the box, we've been doing health equity work for a very long time. So for us, it was second nature. And so the whole impetus of health equity is thinking about patient engagement, right? We can work on a lot of different things in healthcare quality improvement, but if you don't have patients at the center of that work, co-collaborating, co-creating your processes and systems, you may be creating a whole system that when you bring it to community, it doesn't work. So what happens? You have to start all over again. So for us, PPIC, ATW, patient engagement, community engagement, healthcare quality and safety really aligns with the whole overall vision and mission.
I think I'm most proud of our community engagement and early stroke recognition and immediate action in stroke, in which ATW partnered with academic institutions, community partners, and folks that live and work in the South and West Side communities of Chicago to really help folks understand the importance of stroke, early detection, and what are the vital signs. And we worked with these community partners to really understand the unique messaging that needed to be conveyed to these communities in terms of stroke education and awareness. And I'm incredibly proud that our work in the SERIOUS project resulted in the passage of an Illinois House bill which required mandatory stroke education.
What were the major drivers of success? In ATW Health Solutions, it's really to drive that transformation, that change, and quality and safety is simply put, to improve it, with a focus on engagement and equity. There's no other organization that I can think of that brings that value perspective. So we're a value-based organization, right? A mission-driven organization, right? A social impact organization, to be quite frank with you. And what that means is that for us, our core values include engagement. Our core values include equity as a basis in the work. If you're going to change things for people, you have to understand the who you're talking about. And if you understand the who you're talking about, now that brings in all of the dynamics of diversity. That brings in your race, your ethnicity, your age, the place you grew up, the place that you live, the place that you pray, right? Because these things culturally influence outcomes. Healthcare is no different.
I look to the future guided by the vision of Dr. Washington, and I can assure you that patients will remain the engine that will drive the actions of this organization. I can promise you that the voices of patients will be heard. I can promise you the absence of one voice will now become the cacophony of voices that are heard in the work of ATW Health Solutions as we seek to transform and innovate healthcare for all populations.
As we celebrate this milestone, we honor the past while looking ahead. Our commitment to health, equity, and safety remains steadfast as we pioneer solutions for the future of healthcare. Together, we transform systems, inspire change, and shape a healthier world. Thank you for believing in our mission and joining us on this journey. Thank you for partnering with us to elevate voices that improve healthcare quality and safety. Here's to the next decade of transformation.